Hi, Keita. I hope you recover soon. Love you.
Hi, Quito.
Giuseppe? Is that what his name is? Giuseppe.
Starts his pizza crust dissolving yeast in water, adding in sea salt and special finely ground double zero flour.
Self-care at the hospital. Oh, baby.
Adjust the measurements daily, depending on
Now
the
what?
weather. On
Under the
colder
ice?
days, the dough needs less yeast and
Okay.
water. A cadre of pizza makers mold it into pizza-sized balls and let them rest for 12 hours at room temperature. For the sauce, only sweet local San Marzano tomatoes will do. Trianon buys theirs from a nearby grower who peels and cans them without.
Got my nose strip.
The European Union officially recognizes
Love
this
nose
pizza
strips. So,
with a special
you gonna do it or what?
certification called Verace Pizzeria Napolitana, protecting it from subpar imitations. If you don't see extra virgin olive oil, buffalo mozzarella, and San Marzano tomatoes, it can't be called Napolitana. Trianon's team of pizzaiolos are expert at stretching and tossing the dough. For me, the true meaning of the Neapolitan pizza is to make it with your hands.
Take it,
Here,
baby.
they make the traditional pizza napolitana with two types
Now
of
your turn.
mozzarella. Fior di latte is standard. Some customers ask instead for premium mozzarella di bufala, made with
The
local
bufala.
buffalo. A splash of extra virgin
Put my
olive
glasses
oil and
back on so I can
90
see
second spin in
the Italian food being
preheat
cooked.
burning stone oven produces pizza ecstasy.
Pizza ecstasy? Say what?
That doesn't mean right there.
What? That's weird. It's weird that there's not. Just get some breathing in.
It is a reflection of our character, the way we relate to one another. So much more than what you'd expect.
Almost to the top.
If pizza is the spirit of Naples, Ragu Napolitano is its lifeblood, a meaty, slow-cooked tomato sauce.
Whew, did it.
Go back in time to my childhood when every Sunday
Cheat, huh? Halfway. But I gotta do this. She just told me every commercial. Get a couple in.
It's not a commercial.
Well, I know, I just do it randomly too, but because of the anesthesia, something with, what does it say, affects my lungs, possibly. So,
There's something very ancestral inside the ragu. It's a kind of really particular flavor that makes you remember about your childhood, about tenderness.
all right. Self-care going down.
Cabbage and leftover pork parts.
People would gather together late January for the slaughter of the beast. All the
Be
bits
careful.
of the pork that
Okay.
they weren't
Yeah.
using any other recipe would be thrown into that.
One restaurant that still serves a version of cazuela is Mana, a sleek, modern eatery located in an old industrial part of town.
I was born near from a restaurant. I opened this restaurant after 15 years cooking around Italy, and now is a project to my entire life.
Matteo Fronduti, winner of Italy's first season of Top Chef, is part of a bold new breed of Northern chefs.
I mean, she'll be coming in soon and I'll tell her to give me an ice.
This new young inspiration is the Italian tradition.
That one's no good. It's okay.
His version of
Thank you,
cazuela
baby.
doesn't look much like a stew, but it's made with all the same components.
We have the feet, we have the tail of the pork, we have the nose of the pork, the skin, the belly.
Sorry, son. We're here to make money, not spend it. Tell you what, maybe if we sell all these veggies, then you can have some Cheerios.
Well, then what are we doing sitting around lollygagging? Come on, we got the best produce in the farmer's market. Hey, you look a little on the short side. One of our special squashes will make you taller. Oh, come on, man. We
morning breakfast. Some French toast, sausage, banana, French juice.
We had a problem with our organic shipment and the alternate supplier for the week. There is big money in it. Except to pay twice as much for organic whatever. Am I right? Yeah. Also like good food.
And we've got plenty of it, Chip. Cricket Green, vegetable specialist.
Very cool. So, we need 20 bushels of assorted produce. Are you my guy? Wow. Oh, I'm sorry to tell you this, Chip, but I don't have enough to fill the order. I'm gonna have to respectfully decline.
What?
Your boss, Juggerhead. Have a nice life.
Wait, come back that is Dad, why'd you pass on that deal? I thought we were going to make some money.
We are, but a good businessman never promises more than what he can deliver. There's just no way we could have filled that order.
Or is there a way to fill that order?
What'd you say?
Sir?
Don't hand out today, street urchin. Oh, wait, that farmer's kid.
Yeah, when my dad said we couldn't make the order, see, he was just trying one of them hard bargains. Of course we didn't come up with enough produce. What kind of farmers would we be if we couldn't?
Animals? I don't know anything about farming. But you have got a beautiful guy. Here's what we're doing. Get this to your old man. I'll be back in an hour with something to get everything out. Bye-bye.
Pleasure doing business with you. Dad doesn't know what he's doing. He said he wants to sell his produce and make some money. And that's exactly what we're going to do for him. I'm trying to put Green Family Farms on the map.
I'd like to consult Saxon, my financial advisor. Makes dollars and sends to me. But how do you plan on filling the order?
Dilly, the great businessman, always says yes and figures out the rest later. Dad wasn't lying. We really do only have enough to fill half the order.
What are we gonna do now, Cricket?
Now we get creative. Well, Tilly, we did it. Let's go fill that order.
Subjective, I feel
Poor guy. Tilly, I need you to go meet Dad with Steve.
It puts in pain medicine into the like lidocaine.
I suppose 5 minutes can't hurt now? Hey, there he is.
Chip. And
Family Farms is not messing around.
that's right, it's all above board. 100% delicious. Not a single tennis ball in the bunch.
Tennis ball in the bunch. Ha! I love your folksy country sayings. Well, the deal's a deal. Here's a little scratch. What do you match?
Oh, it was a pleasure doing business with you, sir.
Don't go spending it all in one place now. Unless that wholesome foods. Then spend it away, baby.
Chilling in bed. Don't feel good. But they gave me medicine, so hopefully it kicks in soon. I'm very uncomfortable. But we okay. And they took out my IV. I was bruised and it looked really puffy, and they said it was good to come out, so they did that last night. But it was kind of a rough night last night. I mean, I got up at one point to go to the restroom. Keep in mind that they just bring the potty right next to my bed, so I just have to get up maybe 2 steps and then turn around, and sit down. But I did that and I almost fell because my knee buckled. So that was scary. And then got back into bed, and I decided I wanted to sit up a little bit on the edge of the bed, So they said that's okay. So I pulled the little table next to me so I can color or draw, And then next thing you know, just maybe a couple minutes after, Aubrey looked down and there was a pile of, like a spill of blood right next to my leg on the floor. I had been leaking a lot of blood, so I had to clean that up, get me dressed in bed with my dressing on my leg. And so clean that up and everything. Prior to that, I was laying in bed too, and we moved the blanket, and there was tons of blood all over the blanket and on the bed, so we had to change that too. So I've been leaking a lot of blood. And then again, this morning, did the same thing, but they decided to go ahead and change my bandage because they weren't able to change the actual strip of bandage that goes over my incision where the staples are, because they had to use staples. Normally they don't use staples, but for my case they did, because of the way my leg had been crooked for so long that my skin wasn't going to allow them to use the normal stitching that they do. So they had to use staples to give it some space for that skin to get. But yeah, so last night they didn't want me to get up to go out of bed because my blood pressure was messed up, and then just because my knee messed up last time, they didn't want to risk me falling because of my blood pressure and getting lightheaded. So she's like, we have to have you go potty pee in bed under either like a little pan thing, or she said there was this thing that I kind of put there and it suctions it out and puts it in something. It just seemed like too much and it was weird to me. So I said, okay, we'll do the pan. Maybe I should have did the other one, because we did that, and of course when she's pulling it out, spills it, and it kind of goes on the bed and in my bag. So it was great, but you know, things like that happen. It's okay. So they just got me cleaned up, changed my sheets, and yeah. But today I have my physical therapy, and hopefully I passed that test today, because unfortunately I didn't pass it yesterday, because my knee buckled and I almost fell going down the stairs, because they make you go up and down the stairs for your test in order for you to go home. So yesterday wasn't very well, so today I have a second chance to go ahead and go through with physical therapy. They'll just make me walk with my walker, you know, down the hallway some, and then after that they take me to the therapy room where I go up some steps and then walk down the steps. It's 4 steps. They said yesterday I only had to do 2, but we said we'll go as much as we can, you know, a little bit and push it. So we did. I reached the bottom step, and that's when my knee buckled and I almost fell. But they were there for me. They helped me. They caught me, Aubrey and my therapist. And then, so yeah. So today, second chance. Hopefully I get it. If not, they said I'd possibly stay one more night if I can do it. So let's hope. I want to go home, but at the same time, it's not a bad thing staying here, because, you know, you got professional help, you know. So falling here is least to happen rather than me being home, you know. And that's a little scary because, you know, it's not like, you know, something that is easier than at the hospital. You know, they know what they're doing, you know. And so anyways, so wish me luck today. Hopefully I pass my physical therapy, and just straight chilling right now. I feel my meds kicking in because I'm not having as much discomfort right now. Still a little bit, but it's okay. I could deal with, you know, just sometimes it gets unbearable, or crying, you know, because it sucks. But, you know, I'm strong. I'm going to push through. I'm going to get this. So, yeah, there's a little update. I will probably update you guys again here in a little bit. Probably, maybe during physical therapy, I'll have Aubrey record me so that way we can get that. So, thank y'all. And let's get it. Let's walk. Breakfast this morning. We got a nice salad, chicken Caesar salad. My cup of fruit, apple juice. It's bomb. Looks bomb. Can't wait to eat it. Bomb. And then look over there. I got my beautiful assistant. She's great. She's my angel. She helps me with everything. She got me all dressed, brought me my toiletries, so I'm smelling good. Got my do-rag with my fresh stuff in my hair. I love you, baby.
I also have diclofenac, which is kind of a pain med.
Okay, thank you. I just like to be reminded of what I'm taking because,
Yeah,
you know.
A good habit.
Yeah. Well, thank you.
You're welcome. Alright, I will be right back.
Okay. Took the meds. I always ask what my meds are before they give them to me, just because I'm curious. You know, it's a good habit to know, like, what they're giving you at the time, what they're for, and then I get familiarized with what I'm taking more. And, you know, this girl right here is thick-headed, and I don't catch everything at first, you know, so hearing over and over what they're for, the name, and, you know, then I learn that way more. So, I know she's going to bring me my, I can't remember what it's called. It sounds like Lorelax, the cartoon from Dr. Seuss, but something of that nature is what it sounds like. Maybe that's what it is, because it's Lorax for Dr. Seuss. Anyways, she's about to bring me some of that. They usually put it in something to drink. Some people are just use different things so it doesn't taste so bad. I like it in apple juice. I love apple juice. I'm already drinking apple juice for breakfast, but they can bring me another one, because look at the little cup. So they'll put that, it's like a powder stuff. They'll put it in my juice and I can drink it. It's to help go to the potty, to pass, you know. I've been peeing, but not the other stuff because of all the pain medication that they're giving me and everything. They all can cause constipation. So, you know, I know TMI, but just, you know, this vlog is, you're seeing it all. Is what I'm going through, you know. So I just wanted to share this with you because, you know, I do normal vlogs, you know, here and there when me and my girl do stuff, go out to eat, do fun things with my family and stuff, but also show you guys the real, you know, like what's really going on. Why you see my videos, why is this bitch walking with a cane, or, you know, well, it's because your girl's been fucked up, you know. So we're here, we're taking care of it now. For being 36 years old, my doctor is like, damn bitch. And then literally everybody that I've come across, nurses and everything, they're like, what'd you do? You know, you're so young. Yep, it's clear.
Okay. You don't have to use the lid and everything if you don't want to.
Okay. Thank you.
You're welcome. Can I get you anything else right now?
No, I'm good right now. Thank you.
I'll come back and
Appreciate
check on
it.
you. You're welcome.
Got the, I think that's what she said, Lorelax. This reminds me of the Lorax from Dr. Seuss. I always gotta put it somewhere like that. I'm drinking everything. I got water, I got apple juice with Lorelax. Got another water holding up my phone right now. Fluids. I gotta do lots of water and stuff with my kidneys, with all the medication, you know. So, and I'm a big fan of water. I told Aubrey these little cups they gave me, and I have 3 of them in here because they fill them all up with ice water for me. Because I'll be just downing them, and by the time, if I had one, I'd be pushing my call button all the time if I didn't have more than 2, you know. So anyways, I'm used to at home and everywhere every day. Aubrey bought me this big old jug for Christmas, which I love. It's like 132 ounces. It's fucking huge, like fucking big. And what's it called? That's usually what I drink on a day. That big jug, I try to finish it throughout the day to take in that much water. Because before all this, I mean, I'm not a big fan of pain meds, but at this time when I went to this, big surgery, I definitely I'm gonna listen to the doctor because he's like, you know what? Because I even told him how I felt. Like, it's scary. I don't know about pain meds. I have family history on every side you can fucking think of abuse of substance of some sort, right? People can't get it together. That's not me. Myself, it's not for me. I like to be level-headed, so I've never been a big fan of pain pills and stuff, but, also I've never been through such a dramatic surgery, like an intense surgery. Before, when I received pain pills, I think it was like just maybe once or twice before in my time, was because of like dental work or something. But yeah, other than that, I just don't do it and take them. And I definitely don't do it correct, like for shits and giggles either. So, anyways, I just didn't like the way they ever made me feel before, because whenever I got dental work and they had gave me some, I just felt like, and like fucking kind of, it makes me sick, and I get it, that's what they do sometimes, and then they give you a nausea pill, but I just didn't like the feeling. And with dental work, I was just like, just give me some strong fucking Tylenol or something, like, I'm cool, I'm straight. Rather do that. So before this, every time I'm in pain, literally, my clutch is always, yes, I take ibuprofen, because that's what helps, but also, edibles, gummies, tinctures, all that. That's like my number one go-to, and I feel like that's better than taking any pills, It's just eating a little bit of gummy. And I don't go too excessive. Like, I buy a gummy that's, 100 milligrams or whatever, and I eat that for like a couple days. Just when I'm really, really hurting, I'll take some. But mostly it's at night, because at night is when I rest my body, and that's when shit gets real. It hurts more. So I'll just eat some gummies. I have night gummies and day gummies, so that way I'm not like fucking all, tired and shit mostly. So I just get a little loopy, and that's fine, Not loopy, but silly, I guess. Anywho, yeah. So I'm gonna finish up breakfast, listen to some jams. I see Mary J. Blige was on. I've been rocking out in this goddamn room. Let me tell you what. The day that they put me in here, I was jamming to like fucking SWV and shit. And right now my jam is on. So I'm gonna end this vlog here so I can go ahead and sing along to some Mary. No, 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 no. Anyways, you know the vibes. We're gonna have a good day, guys. So stay tuned for the rest of the day, and let's see what the next shit is that they got me going to do, Peace. All right, y'all. So, update. I was having a great morning. What you guys last seen, I was eating breakfast. I was sitting up. I just got refreshed. It was earlier this morning, around 7:30. And then, it was great until a little later. I want to say like maybe 9-ish. The goodness wore off, let's just say, because come to find out, I have a little ball, so you'll see this right here, and it's like a ball of medicine. Let me show you this real quick. Sorry, it's like a ball literally filled with medicine, and hold up. Actually, there might be something wrong. Give me a second. All right. Anyways, I'm back. Sorry, I had to get some shit fixed. So that's my little ball that holds all my medicine. That's kind of just like a numb blocker for my knee. So that little ball has a tube that's connected all the way down. It's like a long tube all the way down in my knee. So that this morning somehow got loose. So it was leaking. So that stuff, the medicine, was not making its way down to my knee. So therefore, there wasn't something there blocking the pain that's supposed to be taking place. Ah, shit. Sorry. Give me a second, guys. It's like, at this point, I've been feeling the incision. All right. I was, let me get back at it. I was here, you know, discussing. I can't remember where I left off, but we were. Oh yeah, my medicine ball thing. That's where I was. Sorry. So I have this medicine ball that is connected to my knee that is controlling some pain in there, right, straight to it. And I had an issue this morning. Something happened a long time. You know, it's connected to me. It's hanging there, so it can snag. It can do things like that. You just have to keep an eye on it. But unfortunately, it was leaking. So therefore, the medicine that's supposed to be going to my knee. And I noticed I felt something wet, like on the side. I wear like boxer briefs, you know, like tights. And I noticed, I was like, it feels wet. And I felt my underwear, and I was like, it's not blood. Usually it's blood, because I've been leaking a lot of blood. But so I was like, that's not blood. So I looked, and I was like, I think it's my medicine. So we called in a nurse, and she checked it out. And she was like, oh, I don't know where it's leaking. It could just be discharged or whatever. And then I saw her like grab that piece and then tighten it where it's connected. And I'm like, yeah, looks like that's where it was leaking, you know. I try to be patient sometimes, and I get it, you know. It's nursing's hard work, I understand. But it's frustrating when you're in pain, you know, and I try to be patient. But anyways, so she figured it out. She tightened it. And then at that time, because I was going through so much pain because that didn't happen, it wasn't time for me to get my medicine for my pain management, because they have, you know, you have to have it within certain hours, right? You can't overdo it. And I get that, and I'm okay with that. I love that. But I just felt like at that time, because that issue happened and I wasn't able to get that other medicine, I was just like, what can you guys do for me right now? Because I was literally laying there crying, trying to breathe, because, you know, you got to do that when you're in pain. But I was just laying there in fucking pain, crying, and it was hell. So after some time passed, they came in, they said, okay, we can give you your meds like an hour earlier. So I got those at the same time that they gave me those. A couple minutes later, another doctor that was a part of my procedure and everything came in, and she had a syringe of the same thing that's in my ball, but way stronger dose. And she was like, I'm going to pump this into that directly, so it just shoots into your knee. And, you know, it was fairly higher amount because she knew I was going through it. And then they were trying to release me today, so they need me to feel good while I get home. So therefore, she did that. She's like, give it 5 minutes, and I swear you're going to feel great. It's like, okay. So then with that time and then the pain meds that they gave me, it was perfect timing. So, yeah, like I'd say like 6-7 minutes later, and it was perfect timing because my physical therapist came in, and then I was feeling a little better because of all that, and it worked, you know. So I got my ass up. Physical therapist helped me, and we literally across my room, which I'm very lucky, is my physical therapy room. So she got me up, helped me. We did a little bit of leg stretches on the edge of my bed before I get going to see how it was. And then I used my walker, walked across the hallway, which, you know, like literally the room next door, you see that door, is my physical therapy. So very fucking fortunate of that. So I walked across with my walker, with her assistance, of course. You know what's so funny too is they fucking put this black belt around you just in case, so you don't fall, so they can hold you, you know. And when she put it on me, it's a big old thick black belt. I was all, you ever seen Matilda? And she was like, yeah. And she kind of knew where I was getting at. And I was like, I feel like Miss Trenchbull with a big old fucking black belt around my stomach. And she starts laughing. She goes, I've never had anyone say that, and I've thought that before. And I'm like, yeah. So we had a good laugh there. It was fucking funny because I was like, fucking Miss Trenchbull, fucking status shit. So, yeah, I'm telling you, no matter what I'm going through, and I'll be in pain or anything, I can't not fucking joke around. It's just, to be serious all the time is just not me. It's not in my DNA, believe me. If you knew my mom, you know. You know Melba. But anyways, so yeah, we went into the physical therapy room. She had me go up the stairs, which I did 2 stairs up and then down. And then she said, "You think you could do it again?" I said, yes. I always try to push myself with this because I'm not fucking around. I want to be better. I want to be able to do everything that I fucking was doing. For being a big girl, I'm pretty fucking active, you know? So I want to go back to playing some basketball. I want to show my daughter and my girl how to box. So I got to be able to hold the pads for them because they need to learn how to protect themselves if mama's not there. And so we did the stairs, and then she said, "Do you think you could do it again?" And I said, yes. I went up 3 steps instead of 2 this time. I pushed myself, went down, and then I jumped on like a bike, but like a glider almost. And I put my legs up there, and I did. Yesterday, they had me do 5 minutes with physical therapy. And she was like, well, you can do it for as long as you want, you know, and see how you can do. So I was like, okay. I was like, can I try 6 minutes? She's like, yeah, okay. So I did 6 minutes, and I was like, I'm going to do 1 more minute because I can go. She's like, you can go for as long as you can. So I said, all right. So I did 7 minutes, and I pushed myself, and it was great. I actually like that exercise machine a lot. It feels good because I can straighten out my leg and then push it in, bend it as much as I can, and it gets my leg, you know, the movement going. So I really like that machine. And then we walked back over here, and I told her I needed to use the restroom, so we walked all the way into the restroom, which is great because it's extra steps. Walked into the bathroom, went and did my thing, came back, and now I'm sitting on an actual recliner and not so much in my bed because I've been in bed, you know, but I wanted to sit up and chill, and my girl's coming through with some breakfast, or not breakfast, my bad, I had breakfast, coming through with some lunch. I would have got it from the cafeteria, but because of all the shit I was going through earlier with my pain and getting settled and everything, trying to come down from the pain, it was already past 12, and normally you have to order your food before. They say like 2-3 hours before some shit. So like last night I ordered my dinner and I just ordered my breakfast at the same time, so that way when I wake up it'd be here. So anyways, yeah, I just chilling now, waiting, sitting here watching a little TV, drinking my water, doing my breathing exercises, just being patient and waiting for my girl to come through. Aubrey's gonna be here in a little bit. She was picking up some Subway for me, and I actually, nurse came in. Good news is the nurse came in and she says, we're getting your discharge papers ready. So yes, that's me clapping because I have my other hand holding my phone. Vlog, but I'm very happy because I'm ready to go home. This morning when they're like, well, we don't know, we might not be able to go home because I was having a rough morning, it made me want to cry more, you know, because I was like, yes, I know it's good to be here at the hospital because they can give me the best help that I need, you know, but I was only the way this procedure goes is you're supposed to go home that same day, but I wasn't able to do that because I had issues with physical therapy, you know, and it's okay. Like I said, you know, if you needed the help, you're going to get the help, you know, you stay, it's better. But I just, you know, it's frustrating and I want to go home. This is the 3rd day. I had surgery, then I stayed a night, and then I was here a full day yesterday, and then today is day 3, but I will be going home now, so thanks, blessings. And I'm happy that I'll be going home. My kiddo's at home. She hurt her fucking knee playing basketball last night, so it's good. I'll be home. I can get on her and tell her to elevate her foot and keep it iced, you know, and we'll see what's up. And then she's supposed to have a game tonight, but I don't know if that's gonna happen because, you know, she's hurting. So anyways, discharge today, yeah, happy. Go home. If she's not feeling good, the kiddo, we're probably gonna lounge on the couch and watch some Grey's Anatomy because that's what we do. You know, I've never really watched full Grey's Anatomy, which is bonkers to me how much there is. What's like 16 seasons, maybe even more that I don't know, but I'm on season 6, with her. We started from the beginning. She's seen all the seasons like fucking 2-3 times already. But so we started it together. Now we're on season 6. Probably getting ready to season 7. So if you know Grey's Anatomy, you know, let's just put it this way. I am like maybe 1 or 2 episodes of when they had the shooting there in the hospital because Derek, there was some issue where like one of his patients died. So the husband came and he's like looking for him to shoot him. So Derek got shot and everybody got shot at that one. But if you know, you know Grey's Anatomy, you know where I'm talking about right now. That's where I'm at in season 6. So, yeah, I'm looking forward to go home, spend time with my girl. You know, I mean, yes, I've been spending time with my girl because my girl's been here with me. She holds it down. Believe me, she's my angel. Because if it wasn't for her, and she's been keeping me right. She knows I like to stay clean and keep it right, keep it tight, you know. So she's come through. She's brought my toiletries. She's brought me all my clean clothes and underwear. She came through to cleaning me with the wipies, you know, helping me. Everything that I need, that I normally do, my girl has done it. And, you know, I couldn't express how much she means to me. So, to my babe, thank you. But, yeah, we're going home today. She's on her way, bringing my lunch, like I said. So, yeah, that's where we're at, and I'm excited. So, just stay tuned, y'all. We getting it. I'm gonna have lunch right now, though, okay? As soon as she gets here. But right now, I'm just gonna jam out to some jams and good vibes, you know? So, let's get ratchet with that ratchet trap music. No, probably I'm just gonna hear, like, oldies. Like, right now, I know the first song I'm gonna hear is Return of the Mac. All right. I'll see you guys here in a little bit. Thank you.
The question remains, who will correct me from the news? Excuse me, Councilman. Councilman, may I have a moment of your time, please, sir? Mr. Savage, as the election draws near and the stakes grow higher, how do you feel about your father and political opponent, August King's recent attempts to sabotage your political campaign by constantly putting your experience into question?
I think sabotage is a strong word. But to answer your question, have you seen the most recent polls? If experience was the main factor in this race, wouldn't Councilman King's numbers reflect that? I can't imagine how difficult it must be to acknowledge that you've crafted a better you. Your time is up. It's Savage season. Thank you.
I'm Rebecca Moore with WGR TV, and apparently, Savage season is upon us.
Hello there, my name is Seychelle, and what makes the Chick-fil-A chicken sandwich original to me is that punch of flavors that's unlike any other. You get the crispy tenderness of the chicken and that hint of sourness from the pickles. Ta-da!
Hey, I'm Juan, and what makes the Chick-fil-A chicken sandwich original to me is every single time you take a bite, you know you're gonna get chicken that's crispy, golden, and juicy. The Chick-fil-A chicken sandwich is the gold standard of chicken sandwiches. There's no touching it.
Junk sleep got you all jumbled up. It's Mattress Firm's new bed, new you sale. Save up to $500 on the sleep you deserve. Plus, get a free adjustable base with qualifying Sealy purchase. Only at Mattress Firm.
Olive Garden's never-ending first course is always on us with every delicious entree. Garden fresh salad, on us. Homemade soup, on us. Now as for the breadsticks, who are we kidding? They're on us too. Only at Olive Garden.
Discover why One Chicago is TV's #1 rated night of dramas. When this community calls, we respond.
There are people who stand steady, who hold on to hope. We continue to fight for the good we see.
Whatever it takes, every single day.
One city.
One family, one Chicago. Strong together. Chicago Wednesday, tonight on NBC.
I went across the hall in the therapy room, and I went up the stairs 2 steps, and then after that, I came back down, and I went up 3 more steps. And then after that, I sat down on that like glider bike thing, and then I did that for. She was like, "How many minutes did you do it yesterday?" I said 5 with the other therapist. She's like, "Okay, let's do that," and I was like, "Okay." So I did 5, and then I was like, "Is it okay if I go a little more?" You know? She's like, "Yeah, if you feel like you can do it, go ahead." So I did it 1 more minute, 6, and then she's like, "How about you just go until you feel like you can?" So then I did 7 minutes on it. And it felt good. I like that thing a lot because I could stretch my leg all the way out and bend it easily. And then I walked across the hallway, walked all the way to the bathroom, went potty, and then she sat me in that chair and I've been chilling. But yeah, physical therapy was pretty good. I made it up the stairs twice, so hopefully it's successful at home.
Yeah, we'll see. Right. I'm just gonna eat a sandwich.
Some Soul Boy. Eat first. I could probably eat half later when I get home or something.
Yeah, I want a bite.
Yeah, or you can have half right now if you want. We could both eat lunch.
Love you, baby.
I love you. I've been hungry.
Good.
I had a salad for breakfast, so. Guess what? Got discharged, heading home. And guess what I get a hit now? You see all my shit in the back? That's all my everything they set me up with. That's blueberry muffin cart. Babe picked up. Look at her. Thank you, baby.
You're welcome. I love you.
I love you. So heading home. Very happy. Pain's kicking in. But as soon as I get home, I'm gonna get those meds in and, you know, be good. So, I was gonna say, are both of those lights blinking? Because then you can't go, but no. Anyways, headed home. Got ready to go chill at home. Get set up there. So, yay. Happy day, huh, babe? We're out of the hospital. Every day. One more day closer.
That happy of a day though.
Yes, it hasn't been. It's been up and down. That's probably what my days are going to consist of for a while though. So, but me being me, I know that's what comes with it, and I try to do my best not to be a grump when it hurts. Most of the time I'm just quiet there trying to contain myself of breathing and fucking crying. But it's okay, baby. She's trying to drive careful as she can with me because of my leg, but she's doing good. Thank you, baby. So yeah, just update. We just got discharged, heading home, and gonna go get settled in and see how the rest of our day goes. Our first day at home. Yeah, my girl, she's it. She's the one. You know. So I love you, baby. Thank you. All right, we're gonna be home here in a minute. Catch up then and see what's up.